Yeah, on this World AIDS Day 2025, we are privileged as Uganda, as a Model Research Collaboration, to have contributed to the findings of a 6-monthly injection that can help to prevent one from getting HIV by 100%. This injection is going to really help to transform the AIDS response, because we've been getting so many people, especially young ones, infected with HIV. Over 4,000 adolescents and young women get infected per week in sub-Saharan Africa. So if we have an injection or an intervention that works at such high level of effectiveness, then we know that we are going to be able to change the HIV prevention landscape. So we have different formulations currently for prevention. Of course, we would advise that people who are not at the level of getting married or committed in relationships, like students, to abstain. Those who can and are married can be faithful to their partners, but it's not always possible. So we have biomedical interventions to those people who are vulnerable and at risk of getting HIV, like the oral PrEP for sex workers, people in discordant relationships, long-distance truck drivers who are not able to have stable partners and yet they are away from home for a long time. So the situations that can put someone at high risk of HIV, these are the people who we are really targeting to have these interventions benefit them. So we are glad that in this year we've had Lenacapavir, a twice-yearly injection that you get only 2 times in a year or every 6 months. It was approved by the Food and Drug Administration in June this year. WHO has also put it in the guidelines, and we've already had Ministry of Health train health workers, revise guidelines, and we'll be getting this drug early next year. We have support from Global Fund and US government to cater for Ugandans who are at high risk of HIV to protect themselves from HIV. So we are happy that with this highly effective intervention, we are really in a good place to change the HIV prevention landscape and be able to disrupt, to respond to the high HIV incidence that has really been crippling our nations for decades. So we would like to really thank many of our regulators and communities where we've been able to do this research, and other supporters, the funders who are ready to make sure that Ugandans have access to this highly effective intervention at such a critical stage. For those who are already living with HIV, there's always hope. We know that ARVs are highly, highly effective if you take them persistently, as instructed by the health workers, and if you live positively. So we all are winning teams. Either you are being prevented or you are safely taking your ARVs and they are working for you, and we'll be able to have a healthy nation. We know there have been lots of disruptions in the funding, but there's always a way out, and we need to keep healthy. Thank you.